Post-COVID condition, aka long COVID. What do we know about the role of vaccination?
Vaccines ameliorate symptoms of long COVID across some studies.
Yes, but the follow-up was short, making it hard to determine effect sustainability. Furthermore, some studies have found that there is no significant effect of vaccination on long COVID symptoms.
So we are at an impasse for vaccination to treat symptoms.
Vaccines reduce the risk of post-COVID condition by reducing the risk and severity of infection.
That being said, there's been only a moderate reduction in risk of long COVID symptoms if an infection occurs in vaccinated individuals.
Well, I think we need to look at how many vaccinations the patient has had and the time since their last vaccination.
We should be moving towards a vaccine recommendation that does not emphasize number of doses, but rather timing of vaccination for high-risk patient populations.
Oh shoot, I'm only a few vaccinations away from a free pizza on my punch card though. Pizza. All right, I'm hungry. So don't take my word for it. Let's hear from the real experts.
Post-COVID condition explains that there's a lot of heterogeneity in terms of presentation, from long haulers to long COVID to post-viral cough. We have patients who have symptoms that present within the first 3 months, but go on for at least 8 weeks, if not longer.
You have a risk and a chance of getting post-COVID condition every single time you're infected, right? And that's really important to convey that to our patients.
The first and most obvious thing is to prevent someone from getting infected in the first place.
One of the strategies that we have and the tool that is available to minimize a risk in getting infection is vaccination.
What sort of sequelae are we seeing post-COVID in oncology patients? The longer it takes someone to recover from COVID symptoms, from side effects, it really delays their cancer treatment, and that can have serious implications. What that means is that patients may not be well enough for their next cycle of treatment. So if we can reduce the risk of symptomatic infection, ensuring that our patients are vaccinated, that they're boosted on time, that we also have those layers of protection. So, the caregivers, the family members are boosted, the healthcare workers are protected.
The best way to avoid post-COVID conditions is to not get COVID. Best way to not get COVID is to get the shot, get the vaccine as soon as it is available to you.